Hi, I'm Mary Ann Tolliver, and I am the Director of Residential Navigation at the St. Louis Arc. I bring people into our residential services that are 24/7 with the comprehensive waiver, which I will talk about soon. Residential with funding through the Department of Mental Health. It's called comprehensive waiver. But one of the first steps you really want to do is determine, what is the current or future needs of your family member? Um, what is your family member and your vision for their good life? What are their wants and needs? What is their support level that they would need on a daily basis? And what type of environment do they want to live in? There are several different sizes of homes that we support individuals as well as other agencies too. We have some homes where there's people who are living with 5 other guys, and there are homes where we have people with 4, 3, or even 2 roommates. So that's kind of the thinking of that environment, who you want to live with, what type of personality would be best for you to live with is important to know. And being kind of have an idea to be really able to identify your personality, which later we'll talk about that in an assessment that you would complete for the Department of Mental Health. Looking at safety and security, some individuals who live in an ISL and or a group home may use remote monitoring. Not everybody can do that, but remote monitoring is a system that's in the house where at nighttime mostly, that if your family member could stay there at night without a support staff, but yet having that extra monitoring where there's somebody remotely who there's sensors in the house and or like a communication box where they can say, hey, I'm feeling scared or I'm hearing noises. They can talk to the person who's who's doing that remote monitoring. So it brings some security there. But that's probably for another presentation, but just wanted to make sure that that's something that you're aware of. What kind of community access does your family member need or you need? And what do you want and what you don't want? Those questions are always important to know. So you might say, well, I already have a waiver in Missouri, and there's several waivers. There's the children's waiver, the Partnership for Hope, the community support waiver. Those are all have a cap. They only have so much money and you can only use them for so many different services. The comprehensive waiver is the only waiver that provides services for residential, which is more of the 24/7 support. And it also has these other services that are included in there, which all of these you can get with other waivers, with the exception of residential. So you may already be receiving some services such as day-hab services or transportation or respite, or to name a few. So what are the steps to access a waiver? First off, you have to have Medicaid. So if you don't have Medicaid and you want services through a waiver and you need 24/7 support, you would want to go to, and Brian can give you this link to get the application to be able to put an application in. That information that you're putting into that application is information just about yourself or your family member. So it's about the person who's requesting Medicaid. It's not based on anyone else's resources or income. If you receive a return letter for additional information, pay attention to timelines. They are very strict on timelines. They don't always follow theirs, but they're very strict on the timelines that they will give you. And you must meet that timeline or you'll have to restart that whole process over again. So after you have Medicaid and you want to apply to be a client of the Department of Mental Health Regional Office. So today there are more than just one case management service in St. Louis County. There used to be just the Department of Mental Health, but now there is another, it's called Center for Human Services. But to become a client, you first have to apply with the Departmental Health, and they will assign you a case manager. So you have to have Medicaid to become a client of DMH regional office. But those are the numbers to call to be able to request a service coordinator. So access to a waiver. So if you now have a case manager, to request a waiver, you have to have a support coordinator or a service coordinator. And that service coordinator will, one, within your ISP or write an addendum on the ISP about the services that you're requesting and why you need those services. So they have to justify the need for that. In the past, they did these different assessments, which was the MOCABI. They did a priority of needs assessment. Those are not the assessment that they're using anymore. They now are using a Missouri Adaptive Ability Scale, and that is replacing the MOCABI. And that assessment will provide several different things. One, it's going to assess you or your family member about what your abilities are and what kind of supports that you need. So there will be a score that comes from that, which will then help establish a rate. And what this rate is either an hourly rate for an ISL or a group home rate, daily rate for the services that you would be receiving under that comprehensive waiver. It also is going to provide a prioritization of need score, and both of those scales are on 1 to 5, with 5 being either the most need and or the highest level of support. So the waiver-based options, there are several different directions you can go. They have shared living models, which are a host home or a companion model, and then self-directed supports, an ISL, which is individualized supported living, which is different than what Beth talked about. Hers was an ISLA, and that is for independent supported living arrangements. So an ISL and or a group home. And I'll talk about the differences between those two coming up. The services that the St. Louis ARC provides mostly are an ISL, our group home. We have a couple of host homes, but we don't do those on a regular basis. There's other agencies such as Momentor, and others, but Momentor is a big agency who really delves mostly and a lot into host home models. So there's a difference between a host home and a companion model. And the differences basically is that in a host home, you would be living with a family in their home, and they would be providing supports and to your family member or to you. And the companion model is when a person is living in their apartment or their home, and they're welcoming somebody to come in to live with them that helps provide supports. I don't know a great deal about those services, but those are out there as part of the comprehensive waiver. Then there are self-directed supports and services that you can receive on those, or personal assistance, medical personal assistance, behavioral assistance, community specialists, money for a support broker, which is the person that you hire to help provide the services and the information and assistance that you need for the self-directed funds. I have websites on here that you can look at to gain more information in those areas, but just a little bit of information about the self-directed supports is that it's based on the principles of self-determination, people making their own decisions of what they want and what they want it to look like. You are the person are your designated representative. You're kind of like the employer and the budget authority. You're hiring the people, you're training them, scheduling them, and firing them if people aren't working to your expectations. And that you have a budget that you're using with the money that is provided to be able to pay for those services, whether it's direct support or one of the other ones we talked about earlier. Obviously, you have to follow the laws such as any other employer. And the 6 components that it includes are person-centered planning. So you're probably accustomed to person-centered plans at this point in time, or an IEP. They're all very similar. ISP is just really looking at you as an adult, and the services that you need and what they need to look like are all outlined within that person-centered plan. Individual, you control the budgets, and there's help from a financial management company, and having backup plans in place is really important because staff don't always show up. And you need that backup plan to be able to ensure that your family member is getting the support that they need. So go on to the website, the DMH website, to look at more information in those areas. So the individualized supported living is supports that's provided in a person's home. And it's determined that this home and this way of living is the least restrictive environment possible for you. You choose where you want to reside, the home, which has to be either owned or leased by at least one of the residents who is living there, or by a family or guardian. Agencies are not the owners. They do not sign the leases on these apartments. And the other thing that you will decide on is whom you want to live with, and it can be up to 4 individuals living together. So it could be you and 3 other people. Your benefits are utilized to cover the room and board costs. So room and board, your rent, your utilities, your food, house supplies, is how those costs are paid. And then the comprehensive waiver covers the costs for all of the staffing, the health and safety needs, and administrative costs that go into that rate. And into that budget. And the budget is created for each person by the agency using the hourly rate provided by the MAS assessment. So before, we talked about the MAS assessment, and that assessment is going to provide an hourly rate for an ISL. And it's based on what the score is for your assessment. And those rates will vary from if you have a score of 1 to having a 5. I'm going to talk about services and what that looks like after I talk about the group home, because services, as the St. Louis Arc provides, an ISL and group homes look very similar, and the philosophy of how we provide those services are very similar, if not the same. So a residential group home is a group of people who are living together where there's, well, it used to be 4 or more individuals. Now I think it's really more like 5 or more individuals who are residing together with staff support. The household expenses are divided among the individuals who are living in the home. And the daily rate is based on the individual's MAS score. So the difference between a group home and an ISL is the budget. The budget is created individually for each person in an ISL, and in a group home, based on that MAS score, there is a daily rate from a score of 1, which is like $287 a day, to a 5, which is going to be a lot more for that daily rate. And that money comes in, pays for all the same things that we talked about in the previous slide for the ISLs. So what do the supports look like? So the first thing with both an ISL and a group home, is the basic health. We want people to be healthy and safe. Those are the first two things that we want to assure. We support people in going to their doctors, scheduling all of those annual exams that need to be taken care of, dental, and just day-to-day support of one, passing the medications, ensuring that all the staff are trained to pass those medications. So people do not have to be able to do those things themselves, and that is one of the things that the staff will do. Activities of daily living. So that whole idea of, okay, it's I get up in the morning, I go to work, or I go to some type of day service, or I'm home during the day and I do volunteer work. So the staff will assist your family member in getting to those, one, getting up in time if they need support with their hygiene or any other tasks that they might be completing in the morning before they would go to work, or to the day program. Then staff are there to support your family member. And the same thing when they come home. So it's to assist them. It's not to do things for them. We're not there to do everything for each person. We want everybody to live as independently as they can and continue to gain skills to be able to direct their lives, make decisions, and be good advocates for themselves. We want to ensure that people are getting out to do the things that they're really interested in, whether that's going to ball games or going to the movies, go out to dinner, going for walks and getting exercise, going to the YMCA, a whole variety of different activities that where the interest of your family member is most important. And social supports. It's really important for everyone to have friends, to be able to contact them, set up plans. We want them to continue to see their family, because families, we're not taking over the family's responsibilities or relationships. We're there to assist the individual to live in their home and do the things they want to do. But that family involvement is very different for each family. Some people go home every weekend. Some people, go home for holidays and have gatherings for birthdays and each of those different holidays. So it looks different for each person. And whatever works best for you as your family is how we want to support your family member. We support your family member, but we also support you and those relationships. If if you are the person's guardian and family, and your family member is okay with you receiving information, we share the basic and all the health information, what the doctor's appointments and individuals have gone to, and sharing that information. If there's medications that have changed, letting you know that. And definitely, if you want to continue to provide those supports to your family member, that's okay too. We just have to be involved in the process because, one, we're the ones that have to implement whatever the doctor orders. And, the staff in the houses have very much become the eyes and the ears of your family member. And help them communicate to different people, different entities, whether it's medical, family, or just other friends. So those residential options. So that's kind of what it looks like to receive that. So how do you get that comprehensive waiver? So you're going to work directly with your service coordinator, no matter what county you're from, what regional office, or what other agency, case management agency that you're receiving that service from. They will assist you. And the first request comes for that comprehensive waiver in an ISP or an addendum to the ISP. And with that request includes a justification for receiving those residential services. Service coordinator, once that has been submitted, the service coordinator sends it to the DMH Utilization Review Committee, who looks at it, and then it's determined as to whether the awarding of that comprehensive waiver is based on the ISP request and the PON score from that MOS assessment. So let's say that's all been turned in and you have now been awarded it. If you're denied it, I encourage people to always do an appeal. So maybe something, it wasn't explained well enough, or there's just more information that's needed, and maybe something more that has happened since that first request went in. So doing an appeal is really important if you're not awarded that and your PON score is high and you have the justification. So the comprehensive waiver is awarded. So there's information then that service coordinator will collect. And that's a housemate survey. So they really want to know what are the likes and dislikes for you, and also what are the things that you want your roommate are important for you to know about your roommate, and things that you just couldn't accept. Like maybe some people smoke and you don't want to live with a smoker. It's okay to put that on that assessment. They will complete a consumer referral. It's kind of like a summary of the information. And they will put the ISP addendum. If someone has a behavior support plan, all that information is put into the Department of Mental Health Consumer Referral Database. Who sees that database? Who gets that information? It is providers. So residential providers will get an email every time a new referral is put into that database. And if the agency is interested and say, okay, yeah, we have an opening. I think that this person would be a really good fit at the opening that we have. Some agencies might be doing new developments. So that's another way for them to get information on individuals who might really be able to live together harmoniously and have fun. And then sometimes people might have ideas of people that they want to live with, but everybody has to have that funding at one time. So that's one thing. Aren't a whole lot of agencies who are doing new development right now, just because staffing has still been very difficult. But as they have new openings, and they think that your family member would be a good fit, but yet maybe they still have some questions, they'll say, yes, I'm interested, and I want to know, if this person goes to a day program or if they're employed. Are they doing something during the day? And that's something that we really need to happen for them, for the person who moves into this place. So that information's out. The agency's, yes, I'm interested. The service coordinator will notify you that they have expressed interest, and it will be upon you to contact those agencies to gain more information, one, on their agency. It's important to ask lots of questions about what their philosophies are, what kind of training do they provide to staff, what kind of backup systems do they have in place for management and quality of supports that are being provided, and inquire if they're accepting new residents. So let's say, okay, you've talked, there's a couple of agencies that are out there, they're interested in supporting you or your family member, and at that point in time, you want to go in and explore those different agencies. You want to go and see where those openings are. Who are the people that live there? Do you think it might be a good fit? And sometimes it might take a couple of meetings in those places to really say, yeah, I think so. I think I like this house. I think I like where it's at. I like the people that live there. Or maybe there's like one person that you're not sure of, or it's you have to make sure that it's an environment that you would want to live in. So let's say you've chosen the provider, the housemates in the house that you've chosen are all in agreement that, yeah, this would be a really great fit. So then what happens? agency says yes, the people who live in the house say yes, you say yes, your family member says yes, everybody's on that page. Then a transition meeting will be scheduled with the service coordinator who will invite the provider agency and their residential team. You, people who are important to you, will be at that meeting. Generally, the residential team who's there is generally the manager of the house, coordinator, the director, and our nursing staff are there because there's so much information that people need to learn about you or your family member to be able to, for them to be able to provide you the services that they really need. So the meeting gets scheduled. It's not the end of those meetups. Those meetups are going to continue to happen until the day somebody moves in. So the meetups are continuing, the transition meeting happens. There's a lot of information that's shared back and forth, which are, they look at financial, medical supports. After looking at the ISP, are there any questions that the staff might have? Or with you meeting at the house at those different meetups, you're also getting more information about the individual, and there might be more questions that come from there. So getting some of those questions answered in that meeting is a good place for it to occur, but also when those meetups are happening, to have that continued conversation with each person. One thing that at the ARC that we have, I don't know that other agencies do this. My main job is to work with people who are moving into residential services. So I am like on top of these things to assure that they're happening and assure that everybody's questions are answered. Our nursing support will also meet with you and your family member, potentially whoever has the most information to review past medical history for people in the family as well as for yourself, so that they have a full understanding of what those medical supports look like, what doctors you go to, because they will be doing follow-up. They will see you once a month to make sure that everything is going well. And they'll also provide training to the staff in the house to be able to meet your healthcare needs. So the meeting happens, the service coordinator writes the transition plan. That transition plan is then submitted to the utilization review committee. If it is an ISL, the agency completes a budget, and that budget is submitted with the transition plan to the utilization review committee. So that all happens, and then the UR committee will, give the recommendation that yes, everything's in place, and then the regional director will say, approved, you can move in. Generally at the transition meeting, there is a move-in date that has been established, and we try to hit that date. Most times we do. How long does it take this process once a provider is chosen? So you've chosen the provider. I'm not talking about the time trying to get that comprehensive waiver. You've got the waiver. You've decided that, yes, this is the agency that I want. It's going to be approximately 2 to 4 months from the time that you've made that decision until it all happens. How long does it take from beginning to end? If you go back and look at the time where you're working with that service coordinator to receive the comprehensive waiver, it could be 6 months, it could be a year, it could be more. It depends upon where you sit with that priority of need score. So after someone moves in, we are working with each individual to make sure that we have a good understanding of what their supports look like. What are the goals that they want to look, do they want to accomplish over the next year until their ISP? And that will be developed at the 30-day review. They're also kind of just talking to everybody to make sure that this is working out. Is it working out for you and your family? Do you think this is a good fit and you're happy with the services, where things are going? Everybody's getting along, and that's kind of discussed at that meeting. So the service coordinator will continue to monitor. They'll stick with you and monitor the services that the agency is providing to ensure that your health and safety needs are being met, making sure that the water temperature isn't too hot. We have to keep it between, I think it's 100 and 110. Medication administration, all the staff go through a training to be able to provide or administer medication. They have to understand what the medications is, what it's for, the side effects that are there, and follow pretty much a good routine on how that medication is passed to reduce any kind of errors that could happen. Access to the community. They want to make sure that you're getting out to the community, that the house is clean and well organized, and that all other personalized supports that you're receiving are being received at the level that they should be. So that was a lot of information with a lot of different directions, the services that are provided, along with how to get those a waiver and what it looks like to go through transition.
All right. Is there an age requirement to get enrolled in the residential placement or group home?
At the St. Louis Arc, we generally support people who are around 30 years of age and older. But, you know, it's been to all different ages that we've provided supports to. We've provided support to some people who are younger than, I think we're supporting someone right now who's 27. So there's a line there.
And in your experience, is it hard to get a comprehensive waiver? What is your experience, and have you seen in general what qualifies a person to get the comprehensive waiver?
Yes. My experience is that what they are looking for is the person in a safe home where they continue to have shelter over their head, and they're receiving the supports that they need to be healthy and safe. And generally, there is nothing that says that a sibling has to provide those services. I think when somebody is living with their parents, as their parents get older and their ability to provide supports may reduce, and not people aren't living the lives that are going to keep them healthy and safe, and or if a family member has a diagnosis that is could be a terminal diagnosis, or it could be other diagnoses of some kind of either mental health issues or that is preventing services to be provided. So generally, you know, I think the most that people have had to be kind of like on towards the end of life and or not able to provide those services before somebody's going to get a comprehensive waiver. I don't know that it's 100% like that anymore. I think sometimes it also depends upon what region that you're living in and the number of people in that region who are getting supports.
And can you give examples of that priority of needs scores, kind of what they mean?
So it's like from 1 to 5. If you have a 5, that means that you're a family, that you are in danger of not having a roof over your head or to receive support that's going to keep you safe.
And how were the priority of needs scores determined?
So I pulled up the assessment from the MOS that I just received today. And I'm just gonna kind of read through this real quickly. Upon scores provided, if the individual meets the substantial functional limitations criteria for waiver eligibility, first off. However, upon only applies when an individual requests a waivered service or a service that has a wait list due to limited funding, which would be for the comprehensive waiver. It just says that it provides upon on a scale of 1 to 5. indicating enhanced support needs due to elevated health, safety, or well-being risks. So it could be the health, safety, and well-being of the caregiver and or the person who is receiving the services.
And in the case where there are a brother and sister who want to remain together if they both have disabilities, is that an option that they could potentially live together?
I think it is an option and potentially could happen. I think it really depends upon whether an agency, one, is doing new developments, or if they have two openings at the same place, where everybody would be able to live together. So it's possible. It's like right now, we have a couple of sisters who are going to be moving here from Poplar Bluff to St. Louis because that's where their family is. And they were living together in Poplar Bluff, but they've chosen not to live together anymore. So it really, it can happen, but there are circumstances where it can't always be the case. I say if that's something that they really want, then you hold out for that agency that can support them in their same home, if you have that luxury to do it.
And then we currently have SDS personal assistant services through the community support waiver. Do we lose that immediately when we get the comprehensive waiver or when moving into the ISL?
Yeah, if you're moving into a group home or an ISL, it's not going to be self-directed funds. That's when you're making a decision for somebody else to hire staff and manage the budget and the money, provide training for the staff, make sure that they're doing all their notes. So there's a lot of similarities, but yeah, it's once you've made that decision to go into an ISL or a group home, that does stop.
What is the next step for an individual living with an elderly parent with heart conditions that has been denied the comprehensive waiver? Both the individual and the parent want the individual to be in an ISL or group home setting. An appeal has already been denied. Can they appeal again, and would an attorney help?
I would say that yes, you can appeal again. I would say that attorney might be able to give some support there. I don't know why that transpired. So I don't know if the justification wasn't strong enough, or if that priority of need score 1 wasn't high enough. So that would be something to kind of talk to your service coordinator to get maybe more information on that. So yeah, I would really want to understand why, so that you can make sure that the why is being justified and can be justified.
And would it be helpful to try for the community waiver before appealing the comprehensive denial again?
Sure, I think it could be helpful.
In a follow-up, they had just said, what if the individual seems to be regressing and needs placement as soon as possible? Would that speed up the timeline?
Mm, mm, It could. It depends upon at what point you are. One, do you already have Medicaid? Do you have a waiver already? Do you have any kind of in-home supports that may be provided? Sometimes going through this level of support, like if you have a community waiver, and now you need more support, and you bring in-home services through Medicare or from senior services, and then it goes through the waiver once you're receiving there and you need more support and it really indicates that you need the waiver, then sometimes that kind of helps that process for the Department of Mental Health to really kind of get that feel for it. Yeah, this person's been using services and their support needs are continuing to increase. So I know that's not a really good answer, but each situation is different. As the department will say that they're not in the business of emergencies. I tell families that it's really important to start planning ahead. We have a series called Planning Forward, which we're starting one next week to assist individuals to look at all the different life domains and identify what's important to your family member, what's important to you for them. And, you know, having Medicaid in place, not necessarily waiting to the end or until you are in a state of emergency to apply for that. Because it can take a long time for Medicaid to be received as well. So if you're gradually going through steps to get things in place for the time when you are ready to start moving in that direction, or at the time that the Department of Health is going to see that your priority is high to receive that service. So don't wait until the end, till you're in an emergency situation to kind of start the process and understand the things that you need to have in place to help the process go a little bit more smoothly. But with government, you know, nothing ever goes fast. It's just the way it works.
And then how long is that process of putting an individual into a residential setting?
It depends upon where you're starting with that process. If you're talking about receiving just the comprehensive waiver, that could take a while. You know, like I said before, it really depends upon the individual situation and how what the intensity of the situation is, or the urgency of that situation. But if you are looking from the time, let's say that, okay, they said that you're going to be awarded the funding. Sometimes it takes a while to get from being awarded the funding to filling out the paperwork that I talked about, which was the referral, generalized form, and the housemate survey. Those have to be completed. And then they have to wait for a slot to be open before they go into the consumer referral database. So, you know, that could take a few months. And then once you are in the system, I have identified a provider agency who has accepted your family member. From then, it could take, you know, 2 to 4 months, I would say. Could be 6 months, depending upon the situation.
And then can you get on a list for the group home, but then pass if you are not ready to move forward?
So you could get on the list, yes. Is that on the list without a comprehensive waiver? And when I mean, we're gonna really look at people probably more strongly if they already have that waiver, because once we have an opening that occurs, we want to fill it as soon as we can. But we're going to wait for the right person. We're not just going to put anybody in there because it has to be a good fit. So if you are offered, you've applied for, you've received the waiver, and I guess you do want to hold out for the right fit. If you're really ready to move, then I would move forward, but don't settle on a fit that you don't think is good. But if you have the waiver and you just decide, no, I think I'm going to wait, I'm not sure how that works within their system. Thank you.
Thank you.